Okay. Oh, gotta remember which one I had. Okay, better way to do it. Inbox. I'll go right to our chart here. Okay, great. All right, so I'm going to create a new encounter for today. So Liba and I yesterday actually got through all of the GYN suite, and we went all the way through the OB suite, with the exception of after labor and delivery, the patient coming back in for her postpartum follow-up. So I'm going to go ahead and start from there. So I'm going to go ahead. So again, for all your GYN and OB patients, you're always going to be using the OB-GYN home as your home template to start the charting process.
Susan, before you go into, can you just go through a brief recap of yesterday's?
Sure.
Yes.
Yep. Let me close this and I'll go to the chart I was in yesterday. Okay. So I'm going to just minimize that down. Should be this one right here. Okay. So I'm going to come into OB-GYN home. So this is the one Liba and I went through yesterday. Let me pin this history toolbar away. Okay. So again, the difference, between, of course, the GYN and a patient initially coming in for their first OB visit is, again, we're still using OB-GYN home, but the visit type is what's going to drive the templates on the left navigational toolbar over here. I'm actually going to go to the previous visit before that because that's the one that I did the OB initial on. So let me minimize that one. Let me expand this one. It should be this one. Okay. Yep, OB initial. So everything works the same way, except again, the visit type is going to drive this set of templates between these two separator lines. So you don't see the GYN office visit. So once the OB prenatal initial is selected, again, when the nurse rooms the patient, she can go through her same processes. She can still follow the templates that she would use on the left navigational toolbar, such as coming in and going right to her nurse doc and entering in her vitals, updating past medical, family social histories. If any type of an office diagnostic would need to be done at that time, if you're going to do like a pregnancy urine or something, she can order it from here and result it. So that presets the visit for the doctor. All right, so all this information would be encompassed right on the OB initial encounter date. So after that is done and the patient is now ready to see the physician, their starting point, again, I don't know exactly what your workflow is going to be in regards to what the nurse is going to do versus what the physician is going to do. But I'm going to take it as the physician is going to be going through the first trimester tabs in here. So we're going to come down here and start right at gestational age. And you'll see the significant difference in the templates, okay, for all across the top here. So as Liba and I went through yesterday on this particular patient, we indicated that her initial visit to the office for her first OB visit was on 6/1/2011. We marked it as her first trimester. Then we come down to the initial EDD. All right, so we're basing the EDD off of the patient's last menstrual period. So I just grabbed 4/22/11, so it calculated out an estimated delivery date of 1/27/2012. Then we did the patient was actually and had their initial exam, so I populated it with yesterday's date, and based off of the physician's findings, we indicated that she was 8 weeks and 3 days. So it recalculated the EDD for us to 1/8/2012. And then we said, hypothetically, we sent her down the hall to have an ultrasound done just to confirm it. So the ultrasound date was yesterday's date, and the ultrasound confirmed that she's actually 7 weeks and 2 days. So it gave me a new EDD of 1/16/2012. Now, to calculate the working EDD, you take the ultrasound date, which was the estimated delivery date here, placed it into this field here, and then we calculated it out. All right, so that gives us the actual working ED that's been adjusted by the sono. Now, I worked very closely with one of the physician resources at NextGen, who is actually an ACOG. They're an OBGYN doctor. And when I explored these fields up here, as I explained to Liba yesterday, she says, realistically, she says, OBs don't usually use these fields up here. It's up to you. It's going to work in the same way. It's doing the 18 to 20 week EDD update in case anything should change in regards to the quickening, the fundal height, at the umbilical cord, maybe by another ultrasound. So you can actually recalculate at a later time through the pregnancy if actually the date's going to adjust.
Well, two things, Susan, two things. First of all, we have kind of a rule. Once we assign an EDD that's confirmed with ultrasound, we never change it. No.
Yeah, and that's exactly why she told me usually most OBs don't use this.
Right. And
so
MBIL is the umbilicus. It's your belly button, not the umbilical cord.
See, I'm not a doctor.
That's why I'm laughing.
Is that Dr. Dorfman that's here with me again today?
Yes, I'm here for a little and I got to change offices, and then I'll be on my desktop.
Okay. Oh, laugh at the trainer. I love it.
Okay.
All right. So then we came down. So again, it gave us our, as of this encounter, the gestational age of the baby. We indicated that it was going to be a single birth. And then from this point down, we go ahead and look at some information here in regards to her last menstrual period. Does she know it was definite? Maybe it was unknown or approximately. Does she have irregular menses? How frequent is it? When did it start? Was she on birth control at conception? The HCG and, her prior menses. So we put all that information in there. A little bit further down this template, I really don't think there's much more in here on this first tab. It's really this is the lesser of all the tabs up there. So again, from a workflow perspective, I don't know, is this something the nurse would do and then the doctor would make any changes to it? So again, I don't know what your workflow is, so you're going to have to determine that.
This type of thing would be the nurse probably.
Okay. As I explained to Liba yesterday, this little checkbox up here, completed, really doesn't do anything other than saying tab 1 is completed. It doesn't trigger any functionality in the database except to change this little red X here to a green check mark. So that's simply saying that tab 1 here is completed. And then you can move on to the next tab. So the next couple of tabs are the ones that have the most data in it. So I'm going to toggle over to medical summary. Okay. So this is, again, it's going to be copying a lot of information forward. First and foremost, from the patient's past medical history, it's going to go ahead and pull in total pregnancies, full term, any spontaneous abortions, whatever, happened with the patient. You can make updates to it here. But again, it's pulling from the past medical history. So if you do make any changes here, it's going to update these read-only fields. So for any reason, the patient indicated, oh, I forgot to tell you, you could update it there. The next grid underneath there is past pregnancy history. As Liba and I discussed yesterday, again, getting all the past history in there, we can't make this any more sugar-coated than it is. To add past history for past pregnancies and deliveries, you're going to click on this Add Detail button, and it pops up a template where you can see I've actually already added a few of them in there. I went up to pregnancy number 3. So I'm going to just save this. Again, I'm going to clear this whole template so I can add another one in. And as Liba and I discussed yesterday, if this is a patient where her first birth was 17 years ago and she can't exactly remember how many hours she was in labor, or, she can't remember the exact birth weight. All these fields aren't required. You can get the minimal information in here to at least get the history in. So, for instance, if we said this was pregnancy number 5, or 6 rather, I'll go back in there and make that a 5. And that's a perfect example. If you select the wrong thing, just click back in the field. What the sex was, we'll say this was a female, and maybe born, like July of 2008. All right, so 2008. There we go. So there's my 08. If you make an error in here, you can just hit the clear button. Gestational age at delivery, we'll just say 40. And again, if they know this information, we'll say the baby weighed 7 pounds ounces. And how many hours in labor? We'll say like 18. And then if they know the delivery type, if there was, any other items in here that were required, episiotomy done, laceration, so really everything else in here, can be optional for you, but it's, how much data you want to collect. And then you just save it to the chart. So that builds the history for all previous pregnancies. All right, so you can see everything there's the one I just added just now. Or actually, no, it's this one. Okay. Any management complications related to pregnancy? If we double-click in the grid here, it launches up the OB history one-of-one records. Actually added this from another template, and I'll show you how that gets in there. But you can still come in here with the history in here if you had to make any changes to it, manage it. It's just by clicking in the field. So we picked the disease and the condition, what the therapy was, and what the current status is. A little further down this template, okay, here's where all of the screening questions come in. Let me just stop it right to here. So here are all the screening questions in regards to a medical history. And again, as I explained to Liba yesterday, the nice thing about these is we do have this default all to negative. So kind of the same thing with the quick save functionality. You can go in and default the items to negative and then go ahead and chart the exceptions. So that's exactly what I did with her yesterday. I just clicked default all to negative, and you can see that's exactly what it did. And then anything you have to change, you can come in and just change it to a positive. Just below that, again, is infection history. Okay, so again, we can default all to negative and then chart any of the exceptions in there. You also have a nice little comment field here. So again, I don't know if this is going to be part of the nurse's component, and then the doctor will review afterwards. So just, a couple things for you to think about. Just below that is the past medical surgical history. And as Liba asked yesterday, if this patient was a GYN patient being seen in, for her normal well women exams every year, and now presents, with pregnancy, anything that's entered previously in her chart, so as I was seen 6 months ago, and you had my entire medical history, you have my family history, you have my allergies, my medications, everything is going to share over to the OB suite. So it's not like you're starting brand new. So like these yesterday, the ones I entered on the GYN suite, and as you can see, there's like my basal cell carcinoma. It shares onto the OB suite. So the only thing that would have to be done here, of course, is reviewing it. Or if she's brand new to your practice and never been seen in GYN, then obviously, you're going to have to get a complete medical history from her. But it still works exactly the same way. If I come in to add medical here, which is the active text link, and again, they give you comments fields for each component here. So add medical history, and you can see that template looks exactly the same as if I was in the GYN suites, charting like a yearly well woman exam. So here's, the gravida and parity you can put in, gynecologic history, and then maybe any histories from this predefined list. And then, of course, if you had to reach out to other body systems, you would search under this separator line and search by body system, clearing in between each system, issue that you had to add. So it works exactly the same way. So after she delivers, she goes back to, to see her doctor for her yearly visits. Anything, all the new pregnancy information will be in there, everything in regards to her pregnancy and any histories that updated, so on and so forth. Then directly below that, again, here's the allergies. Okay, so here are the allergies that I added yesterday. Very simple, 2 ways to add allergies here again. I can click. I like to start with the template because the template gives you your most common. And you can see this is exactly the same as you saw in the GYN suite and if you were working in family practice. So again, your most common allergies on this what we call a medical record pop-up here. And in selecting one, like we find out now she's allergic to peanut, and it gives her some itching. All right, so it's just kind of sitting there waiting for me to pull the trigger on the Save and Close button. which is going to upload this latest allergy to the grid right behind here. And again, if what you're looking for is not on the template, okay, so let me see, there's my peanut. You can just double click right here in the grid and you will get the allergy module where you can do that broader search. Just to the right of that again, family history, no different there. It works exactly the same way. If I need to add additional history at this point, just click the active text link and off you go. Step 1, choose family member. Step 2, choose the conditions. And step 3, indicate if this condition was potentially a cause of death for the family member or just the onset. But everything works exactly the same way. And always remember the rule of thumb. After these items are added and they're displayed in this grid here where I'm kind of circling around, if you have to make any changes to these, you're going to double click right in the grid to get the pop-ups of the history. So there's my one of 3. So if I had to come in, maybe I wanted to attach a name, change something, that's where you would do it. And yesterday we were getting a little error when I was trying to error forward in the protocols template. So I'm on example here, one of 3 records that are in here. So if I want to go to record 2, don't save and close and then come out here and double click here. Just hit the save, hit the little black forward arrow, and that takes me to record 2 of 3. So it's functioning here. I don't know what's going on in protocols. I don't know if that's just if it's a database issue or what, but we'll get that straightened out. So that's always how you would update. Then further down, though, you'll notice too here, you've got these active text links here, page 1, page 2, page 3, and page 4. So if you were at this point on the template and you just wanted to fire down to the last part, the risk factors, to evaluate the risk factors for this patient, you could just click on it and it's going to shoot you right down the template because it is a very long template and you don't have page down buttons on there, but it's an option or you can just scroll. Now this next little part here is nice to have. It's symptoms since last LNP. It's a little pop-up that's going to let you select from the checkboxes, or I believe it's radio buttons actually, no checkboxes. So if your patient's complaining of any symptoms since her last menstrual period, maybe she's having a little edema as well as what else is going on. But you can also free text in this field. Okay, I could actually, after I apply those to the patient's chart, I could click right in there after the period, space, and then again, free text any additional data. So you're not limited to just what's on the checkbox. And again, as you can see today, I cannot type. And medications as well since last LNP, this is 100% free text field. It's not pulling from the medication table. So anything that's in there, you would have to free text in there. And then the last part of this medical summary tab here is the screenings for genetic, right, and evaluating your patient's risk factors. So again, you do have a default all to negative, all right. My patient's over the age of 35, so it already checked it off yes for me because it's looking at the patient table at the date of birth, all right. Then you, of course, all the questions that are, asked, during the screening. So you check off as required. And then further down there, let's see, we've got just a little comment field. We give you 2 other fields if there are additional questions that you screen on. And then the last part of this is the actual risk factors. And again, you have the default all to negative. So I fired in everything as a default all to negative, and then Leba and I charted out the exceptions here. You have to give your patient a risk level. It's going to be either low, moderate, high, or very high. And then you indicate that the first trimester medical summary has been completed by clicking the checkbox. So this and one other one, this I think is your biggest tab in here. So again, you can think about, if who's going to do this. If the nurse is going to do it, and then the doctor's going to go back and review it, whatever the case may be. But then if you'd like, click the checkbox to indicate it's completed. Mostly for this little checkbox here, the OBs that I have worked with, they just don't check it. If they haven't completed the tab, they'll leave it unchecked if they have to go back at a later time during the day and finish charting it. And I'm not sure if Leanne showed you this or not. Obviously, you're very busy through the day. You're seeing many, many, many patients, and it can be a little disheartening when you're working on one chart and all of a sudden you have to stop mid-charting because you've gotten behind and you need to go in and see your next patient. Nice little thing you can do for yourself here is utilize the tracking option to update the appointment status in your inbox. And the option in there that's really nice is if I come to tracking, let's say no, I could actually come into the status and indicate that the chart is incomplete. So that means, when I get time later on, maybe in the afternoon to, sit down and finish my charts, I can go right to my inbox and identify immediately my charts that I didn't finish. So that's just a nice little option to have in there, so you're not hunting and pecking, trying to remember which ones you finished and which ones you didn't, since there is a lot on these templates. Any questions on the first two tabs?
No.
Okay. We'll fire in now to OB Social. Okay. This, again, anything that you chart, and say if my patient, again, was a former GIN patient, now presents pregnant, anything that was charted on the social history template in the regular GIN suite is going to transfer over here to the OB suite, with the exception of a couple of fields. Over here, like everything in here, where I'm kind of circling around, this would all have to be populated because this isn't pulling from anywhere on the social history template. But like yesterday I indicated, our patient was a smoker, had smoked for 20 years, that they consumed alcohol, they consumed caffeine. I didn't put any lifestyle information in here. Didn't really put that much more in it. So like I suggested to Liba yesterday was, now that you're seeing both pictures here, you're seeing, how it would run in the GIN suite versus the OB suite. This will help you, I think, to determine what factors you need to capture, in the GIN suite if, your patient's now presenting pregnant or vice versa. So it just reduces the amount of, data entry when you actually get to this tab in here. So, again, scrutinize the template and decide, yes, we want to capture this, and this. So when I get into OB, everything's going to be defaulted in here for me, and you would just have to verify it with the patient. Again, of course, with the exception of baby's father, phone, who a support person is, the pediatrician, are they going to take prenatal classes, feeding, does your patient, again, agree to a blood transfusion, do they desire sterilization after labor and delivery, just any of that part. But so that'll just kind of help you to decide what you're going to get to. And again, you have the link right to the confidential template on here as well. So everything that I charted yesterday is in this confidential template today, tomorrow, next week, a year from now. It never leaves the template unless you physically go in and clear it out or make changes to it to update it. So that's not too much on there, but it can end up being a lot of work with the social just because of the amount of information that you're collecting. Questions on this one?
No.
Okay. Lab results. This one just puts a little frown on my face just for this reason. When Liba and I talked about this yesterday, when your patient presents, for their first trimester, there's first trimester labs that are usually ordered, and they can be done right from this template here. It's going to take you to a different lab master, quote unquote, than you were seeing probably in the GIN suite or you're seeing in the family practice suite. So if I needed to order labs, I can go right to here and you'll see the difference on it. So I'll just click on it here to show you. So it's going to it's closing my OB suite behind there, and it fired up and opened up orders for me because you can see on here the difference. Order OB labs. We have the first trimester, second, and then third. I don't know exactly what labs you do, but there is a predefined trigger in here that when I click first visit, it's automatically going to check off what the developers of this template feel are done at the first visit. So you'll see when I click it off here, everything that just checked off for me automatically. You're not committed to all of these labs that just checked off. If all of these are the labs that you would order with the exception of, say, this rubella, you just simply uncheck it, and it now does not come a part of the order. And then the vice versa. If there's additional labs you need to order, then you would just select the check boxes corresponding with the assessment. Or you could choose to not use it at all and just check the ones that you're going to order. But the thing is, after it's done, you need to place that order.
Can we
So it'd be
those or are they set in stone?
Yeah, there's a trigger behind there that does that. You would actually have to modify the template to tell it to not check off certain ones if you didn't want it to do it.
Okay, so we'll work on.
Okay. Yeah. So again, I don't know what your package is for first trimester labs. If you looked at that and you thought, no, we don't do that. No, we don't do that. Maybe you want to think a little bit down the road of modifying the template so it doesn't check all those off and just the ones you want. But the caveat to this is when I order these labs, the first trimester labs, are you going to have a lab interface at some point where the labs are going to flow back into NextGen electronically?
Yeah.
Okay. That works beautifully, using the orders module. But the difference between that and how it works in the OB suite is this. So if we placed an order, say, in family practice for a couple of labs, and, we sent the order electronically to the lab, the patient presents, has their labs done, and then the lab results are transferred back to NextGen into the patient's medical record. So you'd be able to go right into the orders table and look at the lab you ordered and look at all the components and the results. Okay, then you can do your medical decision making based off of, what you're looking at. The difference in the OB suite is you can order the labs, but when the labs, when you're interfaced, these are your options. I'm going to go back to the lab results tab over here from the left navigational toolbar. When those results interface back in, they do not, and I said do not, update this template. You're not going to have your results fire into these fields here. As I explained to Leva yesterday, this would be a manual process to come in and result the initial labs, all of these right here. Okay? That's an option to actually come in and do that. Your second option would be to just scan the results in until your interface is up and running if you don't have it at that time. So you would take the document of the lab results and scan it in through ICS and send it to your doctor's PAQ. Or the other option would be is to actually go in and do some mapping to this template here to pull the results in. I'm not going to lie to you. It will take some work to get it done. It can be done, so it's something you'll have to think about. So again, it's either manually put the results in, it's just scan the results in so the doctor can review them in the PAQ without putting the results in here, or at some point with your interface complete the mapping process to get them to actually pull into the fields here.
Okay, so with the mapping, if the mapping can only work when the interface is functional.
Yes.
Okay, and is that a separate request that we would have to make from NextGen to develop the system to have it mapped over?
Yes, ma'am.
Okay. Thank you.
And if you're not comfortable doing it, you could get a NextGen trainer to do it.
Okay.
All right, so having said that, all right, so again, as Leva and I went through yesterday, I came in and defaulted items to today's date. I could actually click the date in here, and when I click OK, it defaults at least the date in for me. And the fields, they're not free text fields. It's actually looking at the test and then giving you a pick list of what you actually can select from for the item. So you can see as I click through here, based on the type of test result, you can pick from the pick list. So it's not too labor intensive, but again, I'm not looking at a lab to see how long it's going to take you to interpret it from the documentation to actually get it into here. But if we do that, then again, once this is in here, the doctor could actually then at this point look at this and indicate that it's by clicking this default button that they've all been reviewed. Okay, and you actually don't even have to have the results in here. You could review them if it's a scanned document in the interim to the doctor's pack, to then come in here and say that you've reviewed them all, and then you could make a little comment here that lab results, scanned to patient's chart, reviewed, whatever comments you had to make. So it's documented to the chart that you did receive the labs and they've been reviewed and you've taken action if necessary. So you've got your initial labs, then you'll have your optional labs, and you can see if I scroll down here, there's your 8 to 20, there's your 24 to 28, and then there's your 32 to 36. So whatever labs, that you order, okay, you can do the same thing. And this last grid here down the bottom, this is what's the nice thing. Once you are running with an interface, okay, this big empty grid down here will actually house all the results. So, for instance, if those were on my initial labs that were ordered, okay, it would have the date, the encounter date, it would have the names of the tests, and then it would have the components and your results, and it builds in a column fashion. So you'd be able to actually get a bird's eye view of all your labs right down here. Okay, so just food for thought. Any questions on labs?
No.
Okay. Education. This is the least amount on here. So what I did yesterday, I came in and we indicated that we did our first trimester education with our patient, and we did this by coming up here and clicking on this active text link for first. There's your second. There's your third. So I'm going to go ahead and click on it, and I'll show you what's in there. Okay, so this is the first trimester educational template of everything that we educated the patient on. There is no check all button, so this is going to be click, click, clicking through. But it does stamp it that it was completed. You've got some comment field here, something that maybe needs further discussion. All right, so these are free text fields. And then we give you 2 other fields down here. Now, you've got a little extra real estate on this template. We do have a practice template that if you needed to add a little bit more on this, it can be done. So, like Dr. Dorfman, you may have to review the educational templates to see if they're complete and to the satisfaction of your team there. If something needs to be added.
Yes.
Okay, so that might be just something to put on, your back burner. But after the education is done, we're going to mark the first trimester education being completed and just click OK. And once you do that, that's what's going to populate the grid out behind here. This is empty until you actually come in and do that. And you mark it, it's been marked as completed. All right, and then you have just any little comment you want to put in here. And I think, do we have one more? We have a nice little comments field down here just to add any additional, information. And that's really it to education. Any questions on that?
No, but the lab results, the ones that you're putting in for first trimester, second, third, whatever, can you print out like a summary report of the data that's entered in there?
Yes, ma'am. There's not much you can't print out of a patient's chart.
I'm sorry?
There's not much you cannot print out of a patient's chart. You can pretty much get anything you need.
Okay.
Okay. Okay, so here comes the shiny template, one of my favorites in here, the prenatal detail. At the initial visit, the prenatal detail template is utilized to its fullest capacity. And what I mean by that is when we look at it, it's going to pull in some demographic information. We got our patient's age. From the medical summary template, it indicated the risk level. You got your graviton parity. You've got your, EDD information. Okay, everything from the first and second tab. When the vitals are entered, when the patient presents, when the nurse does her vitals and she enters them via the nurse doc template, it's going to update the first 2 grids here, all right, automatically. And then for subsequent visits, every time she comes in and those vitals are done, It's going to update the the last weight and then the pregnancy weight. So it's going to give you a tally. You'll be able to see how much weight the patient is actually gaining as she, progresses through her pregnancy here. So, but, initially we have to get the information in here to pull the trigger to start the count. So, based off of, the weight, I mean, if we have history that's going to give us, if she knows she was 115 before she was pregnant, and the last weight we did, which what Liba and I did yesterday, was she weighed 130 pounds, so she's gained 15 pounds. So that'll keep that running tally for you, so you can keep that in check. Pulls in, a little information from the social, okay, the father's name, the support person, the status of, breast bottle or doing both for baby for feeding. Okay, then we have the first initial physical exam that was done, which was dated for yesterday because that's actually where we did it. And the prenatal record, where does this record, where does the ACOG need to go when she presents for delivery? So there's just a pick list in here. So this is a pick list that you'd have to edit, of course, to get the names of your hospitals in there. But, if it's not done at Go Live, of course, I can just cancel that and free text it in. All right.
Susan, is that a manual send of the prenatal record, or do we have any electronic capability of sending it?
For the ACOG, you mean?
No, if you have prenatal records sent to L&D and we would pick the hospital is what I'm presuming.
Yes.
The pick list, right?
Yes.
Okay. Is it a manual send that we print it and send it and we're just documenting there that we sent it? Or does this EHR have the capability to electronically send it and it's documented here?
Okay. The answer to your question is scenario one you mentioned. This is just documenting that it's going to be done. The actual ACOG in NextGen is a crystal report.
Okay.
And this crystal report cannot be faxed. Unfortunately, it has to be printed and then faxed manually because it is a crystal report.
But you can set up, because I know another group at Methodist with us has NextGen, and they fax it directly from their computer.
Is it the crystal report or is it? Maybe what they're doing, what they might be doing is actually using the report writer to run the crystal report and save it to the patient's chart, and then they can fax it. I'm wondering if that's what they're doing.
Right.
Okay, if that's the case, then yeah, you don't have to print it at all. You can just generate it and then fax it right out of the electronic health record.
Prenatal report, and then they fax that prenatal report without printing it out.
Mhm.
I mean, so I'd like to be able to do a similar thing to that, because
I don't see why you couldn't then. As long as you can generate it from the report writer as a crystal report, then you can save it right to the patient's history. In fact, wait a minute. Let me retract everything I just said. Okay, yeah, here it is right here. So you can actually do file, fax, and then grab the report and fax it right out.
right, that's what we want.
Yep. Sorry, never mind. Okay, so to again answer that question, yes, this is just a document where we're going to send it, and then it would be a process to go in and actually fax it right out in NextGen.
Okay.
All right. The next grid underneath there is just where we can put in a little more information in regards to vital signs. I'm going to go ahead. This is one I entered in yesterday, so I'm going to double click in the grid. So you can see this is just a little bit different than what we're seeing, with the exception that when the nurse does the vitals when the patient presents, anything that's entered on the vital signs template is going to share onto this template here. So, for instance, we put in 125/85. We put in her weight. There's just some additional fields on here that you don't have on the vital signs template, which you can see. The fetal heart rate, the fundus, the pain. We've got pain scale on the other one. The presentation, is there any edema, and then, of course, the urinalysis information. So it just has a lot more data on it than the normal vital signs template. So if we want to dig a little deeper to add this in, which I think you would, then this is the template to do it. So it all builds in a grid. So if I save this and clear for add, I'm just going to go ahead and say, just add a couple more things in here. And you'll see now I'll have a second grid line out there. And I'm just randomly checking items. So save and close. So I've got my 2 grid lines now. Just below that, the problem detail. This right here, this field right here is what my understanding. I'm not an OB doctor by any means, but just working with the resources at NextGen, my MD resources. This is the part that's really going to continue to document the pregnancy. So initially when she comes in, we're going through all the tabs. Then when we get to prenatal detail, when we get to problem detail, this is where the documentation happens for things that are discussed with the patient, anything that she's indicating may be a problem. And it's a nice little pop-up, and it's different than other ones you see, and here's why. And from yesterday, I put in, quite a few things in here. So to come in here, I can actually double-click in the grid, all right, and this is going to give me this little OB problem list, record 1 of 4. Now, I'm going to save and clear this out. All right. So when my patient's in and I'm discussing with her problem detail, I start up in here. I get a pick list. All right, a pick list of maybe some problems she's experiencing through her pregnancy here. Again, remember, any pick list in NextGen can be modified to add anything in there you need. But runtime, if there's something missing, you're just going to grab the free text line and you're going to free text it in. So we'll say for her that, again, she's having some pelvic pressure. And this is the big one here. This is the one that will, builds that whole running note on the ACOG, if I'm saying that correctly. But to date stamp the problem, all right, you just click on that, and it'll actually put the date stamp in here. And this is where, again, the MD can document all, symptoms, anything that you have to add to the patient's chart. All right. She's got multiple things, we would do save, clear for add, and we would add another one in. So as I explained yesterday to Liba, this is going to be the subsequent workflow for the patient's returning monthly visits. When we come in, or when she comes in, of course you're going to do your vitals and, any other, maybe in-office labs that need to be done. But for the most part, when she comes in and we're just doing that checkup, the prenatal detail is really the only template you're really going to have to use unless there's some other item that has to be addressed. Because when you come in here for each subsequent visit, you're going to come in, indicate a problem, date stamp it with, say 7/1 date, and then go ahead and chart everything that's, going on, per the patient. And that's what's building the whole note. So now that I've added, a couple more in here, here's my fever, here's my pelvic pressure. So this is just going to continually build in this grid here. So I'm going to just slide past that for a minute because when I generate the prenatal record, you'll see, how this all comes into play. Grayed out field, lab comments. This is actually going to pull from the comments field on the lab template. Liba and I were talking yesterday about if the patient has any concerns. These fire in, obviously you can see in red. You can add if the patient's voicing any concerns. If we just right-click Add New here, all right, we can come in and indicate, what the concern is. So it's another pick list in here, and again, any pick list can be modified. So if I have to grab the free text line, I can free text the concern in, and then just save it to the chart. All right, and that automatically will update things in here for me. So at the top, there we go, there's my free text. Another nice big comment field here, just for free text. With the selection of the OB initial, okay, at that point, it should be firing in your assessment, but if you need to add, tweak, or change it, again, These two templates work exactly the same way as we saw in the GIN suite. If I come in at common assessment, it's going to fire up that very large OB assessment, so we could pick from the items on here. All right, so it's going to, it's going to be user choice which template they want to use, because you also have, which has again become one of my favorites, the add or update assessment, where we can pull from diagnosis history, we can pull active problems, and of course, my list. Okay, so here's one item I've added to my list over here. We can also, at this point, again, if I chose labs, that's going to take me right back to that lab template we were looking at. It's the exact same one. There it is right there. Now I'm going to fire right back over to my prenatal detail right from the left navigational toolbar. I don't want to waste any time. As a user, I just want to get right back to where I was. Any office procedures that need to be done? Okay, this is actually going to load the procedures template. And this is just adjacent to the lab orders tab in here. You also can get right to diagnostic studies and right to referrals. So even though you've got all the links out on the prenatal record to go to all these, if you get into orders and you have to do, order a diagnostic or maybe do a referral because maybe at this point you've determined the patient's a high risk, so you're going to refer them out. You can try and get them all done right here on this template instead of having to go here, do your order, place it, and then go back to prenatal details. So if you've got multiple orders, if you can, try and stay right on that template and get them all done. Because if I go to diagnostics and procedures, it's basically taking me right back to where I was. All right, so unless you just have one order to do, then fire away. Custom plans, I think we went over this again yesterday. All right, this will actually take you to the plan template, which is no different than you're going to see in the GIN and in the Family Practice Suite. All works exactly the same way. Nothing different. I don't know if I have anything. I think we built one yesterday. No, maybe we didn't. When did we want her to return for her next visit? So if we come in, we're going to have her return to the office in 1 month. All right, so she'll come back on 7/1. We save that to the chart. Now what I'm going to do now is I'm going to go ahead and review the prenatal record, and this would be your actual documentation that would follow the patient to the hospital when she's ready to deliver. It's pretty beefy is the best way to put it, because it is a crystal report, and it is analyzing all the data, and it looks a little funky when you run it. It gives you this big gray screen while it's pulling all the data in, and we'll just let it run. It usually doesn't take this long, so we're just going to let it do its thing here. Yesterday we got it to generate pretty quickly. Right, Liba? Come on. I don't want to press anything in case it's still thinking. Well, that's not playing nice with us. All right, oh, there we go.
Maybe.
Come on. It's still thinking. This is usually pretty fast. I don't know why it's being stubborn here. Okay, here we go. It's just being very stubborn here this morning. There we go. All right, first and foremost, did you purchase a license for Crystal?
I don't know.
Okay.
We'll check.
Okay. Well, you can check with your project manager, but normally to make any edits to any crystal report in NextGen, you have to have at least one license for it. You know, it can be installed on, you know, one person's workstation, and that would be the workstation that would be used to edit crystal reports. And again, one of the first things you would do is want to come in here and take the NextGen logo off, of course, and put your logo on it. Okay? But this is, for lack of better words, the ACOG. Okay, so what we'll do is we'll just kind of scroll through here so that my doctor can take a look at it. All right, so you can see it's got demographic information. It's got all her pregnancy information, menstrual history, there's all her past pregnancies. There's complications, and I had added diabetes. All right, so that's page 1. Then we're going to go up here to page 2, and it's just basically taking everything from the templates that we just charted. Okay, let me come up here. All right, so family history, medical history, infection history, past medical search. I mean, it's really a nice crystal report. Actually, one of our physician resources, Dr. Galan, actually developed, he's a OBGYN, he actually developed this crystal report for us. So we were very happy when this came out. All right, so, you know, of course, this is going to continue to grow and get bigger and bigger. It's going to be a pretty hefty-sized crystal report by the time, you know, the pregnancy is concluding with labor. There's all the risk factors, past pregnancy, current pregnancy related. She's got some weight gain. Page 4. I think this one actually goes up to page 8 or 9. All right, so this is the main thing I wanted to show you here on this tab here. So again, here's her allergies, here's her medications, here's important information, there's all the EDD information, but right underneath there is the OB problem list. This is the part of the crystal report that's just going to continue to expand and grow, you know, with each subsequent visit the patient has, because for every problem that I add a date stamp, it creates a grid line here on this crystal report. So this is where all the documentation will happen. And there, of course, is my detailed flow of, you know, that one template I showed you where you could add a lot of detail in regards to the patient's vitals and the baby's current status, movement, whatnot. And what else do we have on here? I don't know this whole crystal report by hand. There's the first trimester education. All right, there's all the lab information. Okay, so you can see where I actually resulted it out. It will print out on here. So again, there's your, you know, your options for do I want to actually use the template? Am I going to map it at some point so the data actually pulls in? Because with this crystal report, if you didn't choose to result the template, you can include the scanned results of your lab results until your interface is in and running. So that could become a part of the fax. Let's see, what else do we have here? There's the additional lab. So this went up to page 7. That's what I have so far from what I charted. Do you want me to print this out for anyone?
No.
Okay.
But from here we could fax it, or do we have to save this to another spot and then fax it?
It's actually going to save right to the patient's history toolbar for the visit. So what you would do is, okay, so I just overrode the one I created yesterday. Here is the little crystal report icon here.
Yeah.
All right, so it's saved right to the chart. So there isn't a faxing option when the crystal report is open. But what you should be able to do, and if I'm wrong, I'm going to definitely go back to my my folks and I'm going to say, hey, what's going on? Custom print and fax.
That's, yeah.
Yeah, and you know, it's a crystal report. So let me expand this. There it is, right there.
Fax number and all that.
Yep. So you just pull this over. Actually, I selected the wrong thing. Let me say fax. Okay, and then I'm going to highlight the record. I'm going to pull it over. Okay, then you go just fax it right out. So if, like, your labs were scanned in, you could actually say, show me all ICS images. So that would be a scan, so you could actually pull that over too. So you can pick and choose what items you actually want to send as a fax. Okay.
Of the report?
Okay. Any questions on the faxing part?
No, that's beautiful, actually.
Yeah, it really is nice. Yeah, 'cause some of those ACOGs can get pretty hefty, can't they?
Yeah.
Yeah.
Can you asked if we wanted a printout of the summary before?
Oh, sure. Yeah, you could just. Then when I had it open, there's actually in the Crystal Report viewer in the top left-hand corner there is a little printer icon, so you could just print it. That's why I didn't know if you wanted me to print it, just so if anyone wanted to just look at it.
Someone does.
You want me to?
Yes, please.
Okay. So I'm going to go back over here and open it up. Just double-click it from the history toolbar. Launches the. It's actually. Oh, I didn't even realize it did that. It's loading as a PDF. That's a change. That's nifty. See, no one can make any changes to it. Oh, there you go. That's awesome. Yep, page 1 of 7. You can actually fax it right from here too. Yeah. All right. So let's see what printer this is going to. Then I click on print. Is this the right printer? Is that nearby? Okay. I'll go ahead and click away.
Just what the investment.
That's awesome. I didn't know it converted it to a PDF. No change. Oh, that's really cool. Okay, play nice with us now. We'll just let it do its little thing. I'm not going to touch it. Is that printer nearby?
Yeah.
Does it sound, oh, there it goes. It says it's on page 4. Page 5. Phew, thank God it's not 20 pages.
Yes. I'll check into that, whether they accepted it. Just a flow through.
And that should do it as soon as that one's done. There we go. Phew. Okay, very nice. All right. So moving on further down from that, just additionally at the very bottom of this template of the prenatal record, it's just a grid of all the current orders for the patient. Everything that's been ordered. You can see I did another whole set of first trimester. I had done ones yesterday, indicated they were complete. Yay. So again, this houses all the orders. It's not just today's orders. It's going to be all orders. Okay, and these are actually giving me all of yesterday's date because that's when I did all these. So again, for my nurses, that orders management template is the Jazzy template that can help you manage all your patients' orders. You know, so like for instance, you know, if a mammogram was ordered or the patient was ordered maybe to go to an outside facility for an ultrasound, if it's been ordered, I'm just going to shoot over to order management. Like I said, if I'd had this when I was working at the practice I was working in up in Massachusetts, this would have made my life so much easier. But this is where all the management comes in of all the orders. Let me find something that I can just kind of show you, because I think I ordered, maybe didn't. Let's see. Like this referral, okay? Yesterday when Liba and I were going through this one, we created a referral to send this patient out because she was considered high risk. So if we wanted to update this, the status of it, again, is just ordered. So if the physician came in here and just wanted to see what the status was, you know, has it been scheduled, maybe what the status is as far as follow-up. If I had gone ahead and got this patient scheduled for their appointment to have this other physician assume care, I could come in and just highlight the order, and rather than the status being ordered, I could say that it's actually been scheduled, and we could actually put in a date and time for the provider. So as the provider that referred her out, you know, at any time he can come in and look at the status of what's going on with, you know, the patient, if need be. All right, and then I can just save that. So that actually updates the order to being scheduled. So any given time, as long as they're they're reconciled, the orders can be, it's a great house for them all. And if I complete something in a template as a completed order, it's going to update this orders management template so the talk goes back and forth. So it's just a great holding tank for all your patients' orders.
Susan,
Yeah.
in terms of our workflow here, right?
Yep.
The physician would order the referral at the time that the patient is in the room with them.
Yes.
By the time they get to our checkout desk, that receptionist schedules the appointment to the specialist.
Okay.
Can that individual, the receptionist or whomever, go in there and update that it's been scheduled, or?
Absolutely.
Okay.
Absolutely. It's who you're going to, like Liba and I yesterday talked about checkout, verifying that the patient, has all the information that was given to them during the visit, verification of labs, verification of new medication orders, so definitely it's, what components are they going to be doing within the patient's electronic health record and what you need to train them on.
And other question, the order would come up on somebody's tasks, right?
Yes. When the order is actually, when the physician actually selects an order and hits the place order button, or if they're in some cases with a referral, you add it to the patient's chart, it does initiate the task window, which we discussed yesterday. It's either you task or you don't task. And if that's the case, I would think, the doctor's in the back seeing his patients, and of course the girls are up front, he can certainly task them so they know that's coming. So when when the patient comes up, they're going to, say, doctor's referring me, so the user would get into their inbox, see that request for the referral, like I actually did yesterday. This one right here, referral order, this is how they would actually see it.
Right.
So we'd have the patient's name. All they would have to do is right-click and go to the patient's chart. It's going to take them right to the template, right to the referral. They can see who the referral was ordered from. Go ahead and complete it and go to orders management and update it.
When does the chart get sealed or locked, or whatever term you use, that it's now immutable and unchangeable?
Well, that's up to all of you. Out of the box from NextGen, the lockdown time is 72 hours, but you can increase that threshold to whatever time you need it to be. So if you don't want your charts to lock down for, say a week, you have to initiate a support ticket with NextGen because they have to get into SQL and increase that threshold so they won't lock down for a week, or maybe you don't want them to lock down for 2 weeks or 3 weeks. Especially in the beginning, I think you definitely want to increase that threshold. So, but that's a question you all have to query amongst yourselves to decide, what's the time frame. And at some point, when you're up and running 100% on the system, and charts can be locked down within 72 hours, then again, you initiate that support request with NextGen, and they'll get back into SQL and change it for you.
Okay, I'm sorry, I'm still on this schedule date for the specialist.
Sure.
Now, when the receptionist completes the task, when she clicks on the order, it takes her back here to this screen.
I'm trying to say, it's probably going to take her.
Can we do one that's in an order status and click?
Yeah, let's see. I don't know who I tasked this to yesterday. Let me just look at who this automatically went. I sent this out to. Let's see. It went to the super user. It's actually triggered to go to the super user. So I don't know. What I can do is I'm going to reassign it. And let's see. Liba, what's your last name again? With an M? Oh, W. Ooh, she's all the way down the bottom. There she is. I'll make you NextGen's favorite by right-clicking on it, my user's login, and make you a favorite. So now you're all the way at the top. So I never have to search for you. So I'm going to clear out the super user, and I'm going to add you in. Okay, so now this task is actually going to go to you.
patient, she called from the phone.
So what I'm gonna do is, I'm gonna do file close patient,
Miss Noel?
and I'm gonna do a soft log out,
Transfer your daughter to, just.
and I want you to log in.
Sorry, give back the phone to Rich and then I'll transfer the call, and then she's gonna give it to you, okay? At his other office. Shereen, just hang up, I'll transfer her daughter so you can have her too. Ma'am, I'll transfer you upstairs.
I think it was Jack.
Okay, and go up and click on your inbox for me. So you have no patient chart open right now. So on the history toolbar, it says inbox. Nope, you can close that.
This is his first time coming in.
Okay, there you go. And you should have the task. Go ahead and just click OK.
1 second, okay?
All right, so there, see your task you have sitting there? I want you to right-click on it.
No, ma'am, we're the person that makes the,
Okay, say go to patient's chart. Accept the task.
when you wanna bring him in.
All right, and it's going to close workflow. It's going to open. Okay, it doesn't actually open the referral, which is kind of interesting. It is taking you right to the patient's chart, but it didn't actually open the template for you. I don't like that.
Yes, ma'am. What insurance he has.
Because realistically, what you'd want to happen is it would go right to the orders tab and take you right to the referral, so the checkout folks would see that. Because now, if for you, Lipa, what you'd have to do is you'd have to come in here and you would have to actually find the referral. So,
Wow.
I wonder if that's working as designed. I mean, it doesn't. Usually, that's not how these tasks work. Usually when a task is sent out with the patient and the template attached, it takes you right to the template or even the document.
Yeah, this is a little bit cumbersome the way it is.
Mm-hmm. Let me put that on my list of emailing
Issues.
my physician resource to see if this is working as designed or is this it's something that's going to be corrected. Because I don't like that. Because now the user has to go in here and start poking around. They have to look for that referral document. And her and I did one yesterday. But see, look at me. I'm hunting and pecking just looking for it.
It's gonna take too long.
Yeah, there it is right there. So realistically, this is what I thought it was going to do. It was going to take you right to here. Or at least to the the orders template where you would see it was ordered. But this is realistically what we want to happen. So I'll inquire on that.
Can we open it from the bottom where the templates are, like where the RX is and stuff? Can we open
Well,
the icon?
yeah, I mean, this is the document. If I click in here, actually, it doesn't look like Lipa has access to documents. Yeah, I can't get in there. Let me log out and log back in as the super user here. Lipa, you don't need access to documents, do you? She might, huh? All right, let me go through here. Yeah, see, like NextGen can get into them. All right, so if I type referral, see, from here, you really can't open it because what it's going to do is you have to select it and say generate. So it's actually going to generate the referral. Yeah, so that's not going to work. Let me go back to the physician resources and see if, again, this to me doesn't appear to be working as designed. All tasks usually take you right to the template or the patient's record, either right to the template or to the document or whatever the case may be. So let me find out about that, and I'll have to circle back.
Okay, so you'll let us know when tomorrow?
Yeah, yep. I've got it on my list here. I'll email Dr. Lanzauer and I'll ping her and see what she says.
Yeah, because this piece is really important.
Yeah, I'm really surprised that it's working like that. Because when I look at this, if If I go to modify this, I can see nothing's attached. Now, I wonder, and maybe just as an alternative, if it is something that's not playing nice in the sandbox, let me come down. Here's my, let me get to my, let me think how I want to do this. Let me just get into here. I'm going to go back to orders for a minute. And I'm going to do a referral. I'm going to do a brand new one. All right, so we're going to send our patient to specialty. We're going to send them, say, to, a cardiologist for consult. All right, I'm going to add the referral.
For you, so you don't have to manually do it. But we have to tell it when we want it to do it for us. Yeah, so we can say.
Okay. Leave, I just tasked you again, and I want to check something out here now when I go to my inbox.
Everything.
All right, so there's my new referral. So when I look at this, new referral, okay. Oh, okay. All right, I got it. I got it, everybody.
Okay.
Don't forget the concern. Here's what's going to happen. I come in, the doctor is going to do an order for a referral. All right, so he comes to the referral template right here. He goes and indicates why we're here. We might as well just go through it. He indicates the specialty he wants the patient to go see, maybe a chiropractor. If he has a specific physician in mind, all right, you can go ahead and select it from your physician table.
Okay.
All right. The diagnosis, when you click in either of the fields here, like this one here, it's going to pull up a database pick list of your patient's current diagnoses. Okay, so what the patient has been assessed with. And you can see here are the assessments I have for my patient. So we're going to just pick the pregnancy one here. And what do we need done? Is it a consult? Is it an evaluate and treat, follow-up, student care, for those high-risk pregnancies? We'll just say evaluate and treat. Reason for referral is a pick list, and it seems a little more cardiology specific. So again, this pick list can be modified, or yet again, runtime.
The provider, the specialist is a cardiologist that you just chose.
Yeah, but that pick list never changes.
Pick list never changes.
Yeah, it doesn't matter what I pick. If I pick dermatology, I'm going to get the same pick list.
Okay.
Yeah. Then the time frame, like when do we want to have this, within, let's say 1 week. All right, and then clinical information, free text field. Okay, patient was given instructions. What's nice about this too is as long as the referral usually would come at the end of the visit. So as long as the documentation, the documents have been generated to the patient's chart, when you're tasking this to a user to go ahead and take care of this referral, if you click this little details button here, this allows you to attach, tell the system what documents you want to attach to go with this referral. So if this had been, a visit just, for back pain or whatnot, when I come in here to the attachments, it's going to give me all of the NGN documents, not crystal reports. It's only the documents that are generated from NextGen. But if I just wanted to send the nurse master over with it, I could say include that with the referral. Okay, and that's going to be noted here. So let's send this nurse master over. And then the last step is to add the referral, and then this is like placing the order. So when you click the add button, all right, it adds that referral in, all right, and mine should be right here. So here it is here for my chiropractic care. Here's where it is working. So if I highlight it here and I hit the task button, this is where it fires up my task recipient window, or I could select Leba, add her as a user, or if it's going to a group, maybe it's going to the whole front desk folks, all the checkout folks, because maybe we don't know who the patient's actually going to see to check out. And when I click OK, that's what fires the task out. So the task just sent. So all I have to do is fill the template out, select my recipient, and send the task. Save and close. Now, when I go back into my inbox, I'm going to have 3 in there now. So here's the latest one I just sent out, new referral. This one is working right because when I go in to modify it just to look at it, here you can see it's assigned to LEBA, it's Test Mary, and it's attached to the template. So we'll do it again. I'm going to go ahead and close. I'm going to do file, close patient,
What insurance you have?
say yes. That sounds like a kitty cat.
No, it's a baby crying.
Oh my goodness, it sounds like a little kitten. Oh goodness. Okay, go ahead, Leva. You can go ahead and log in. Shame on me. Okay. Leva, are you always at one location?
Yes.
Okay. You should get your preferences set up. So go ahead and select anything you like and select the doctor. Okay. Go ahead on the toolbar, click on Inbox. All right, and just say OK. Okay, now go to the very top one and right-click on it. Open Patient's Template, accept the task, close this chart, opens up, takes you right to the template. So here they can review everything and go ahead and take care of the referral. So they're not firing in blind.
Okay, hold on.
Yeah, so even in here, you could come in and say that it's been scheduled. You know, see on the left-hand side where it says scheduling?
Yeah, that's what I'm...
Okay, you can say it's been performed, the date, the time, location. You can, as long, over on your left-hand side, see where it says authorization, consent, scheduling? If you click the checkbox for scheduling performed, that's when all those fields become editable, so you could go in and put the date, the appointment time, the location. And if you update it here, it updates orders management for you.
Perfect.
Okay? Phew! I was getting nervous there. Okay, so we'll say save and close. All right, good. All right, so I'm going to do a soft logout, but I'm going to keep her open because, again, I can log off this system, walk away, wait for 5 minutes, come back in, log back in, and I'll be basically right where I was. So you don't have to close the chart just because you're doing a soft logout. If you just need to leave the room and you're going to come back in and do more charting, just walk out the little exit door, what we call that soft logout, and then you can come back in. So if I was working on, let's say, for instance, which one was I in here? Maybe I was on that OB prenatal detail, and I did a soft logout. I come back in, it's going to take me right back to here, which takes us right back to where we were. Okay, so listing of all the orders. There we go. So there's all my referrals I did for, I scheduled it, so it's updated here. So everything talks back and forth. Okay? But again, that's what I love about orders management. Instead of getting into the chart, clicking into orders, I can just go right here and get the status of everything, as long as it's utilized and reconciled.
Susan, can you have two charts open at the same time?
Yes, two users can have the same patient's chart open. You just can't be charting on the same template. It'll say, like, if I was logged into here and I was working on her prenatal detail, and then Leva logged into this patient's chart in the next room and tried to update something, she'd get a little pop-up that says the template is locked for update. And that's your flag that somebody else is actually working on that template. But she could go anywhere else on the chart and do something.
No. Well, let's say the provider's working, let's say on this chart. But let's say, okay, he still needs more information. He still needs to add more information. But, you know, other patients are waiting. Can he just minimize this and then open a new chart?
Oh, no. You have to close the chart to go to another chart.
Oh, okay.
Yeah, I wish you could. The last EHR I worked on, you could actually take a chart and put it like on a hold, and then go open another chart. And I put that enhancement request in with NextGen like 2 years ago.
Once you close the chart, it seals automatically.
No.
You can go back.
You can put the tracking on it to say it's incomplete, as you showed
Yeah.
us earlier.
Yeah, that's why I think that's really going to get utilized a lot, because it helps you track You know, like I said, if I had this patient, I could just say, my chart's incomplete, I'm gonna get back to it later. So that really works nicely. Okay, and I would definitely utilize that. It's just a nice tracking system. So when I came to my inbox, I would see, of course, we don't have her schedule in here, but the status right here would say chart incomplete. Yeah, so I think that's a good thing to have. And you,
You wanna do that for the 1st of August?
okay, so really, everyone, that is the end of a the OB prenatal initial visit. But we still need to talk about this tab here. But as far as charting an initial OB, that's your flow. So now it's determining who's got to do what.
Yeah,
You know.
yeah, 'cause it's
Now the last tab on here, encounter detail. I don't know. I hear different things from being in the field and having worked with a lot of OBGYN specialties. That if I'm coming in for, say, my next subsequent visit, okay, again, normally what's going to happen is, you know, you're going to decide what components, what part of tabs may be utilized at the subsequent visits, the monthly visits. But if nothing has changed from month to month, or, you know, nothing that you have to change in any of these other templates until you get to the second trimester, then you're going to do, of course, the second trimester labs, you're going to do the second trimester education, you know, everything you do currently now. Otherwise, you're just going to fire right over to the prenatal detail, and you're going to utilize this problem detail. That's where all the documentation is going to happen for all the subsequent visits. Okay? And then, like I said, anything else that needs to be done utilizing the other templates on the tabs here. So my question to you is, like I talked to Leva about yesterday. So if a patient's an OB patient, she's coming in for her monthly, you know, check. But now, while she's there, she says to you, I've had this sore throat for 3 days that I can't even stand, okay? Is that a service? Because now we're taking an OB, you know, follow-up visit, you know, the next month. And we've seen her for her prenatal care, but now we're seeing her, she's indicated she's got this horrific sore throat. You take a peek at her throat, you see the little white pus balls in there, and you think, oh my goodness. So we're going to do a swab, and then we're going to have to do what we need to do to treat the patient. Are you able to bill a visit for that?
Yeah.
Yeah, because you're actually, you're now addressing a separate issue that the patient's complaining with. So that's the reason I ask you. So you may need to circle back and find out how the billing process is happening now. I've had some providers tell me, oh gosh, no, I don't bill anything for it. I just treat her and let her go. But the fact is, though, that you still have to document the electronic health record. So that's why you have this encounter detail button. So outside of all of these tabs here, okay, if I now say, oh, can you please look at my throat? It is so bad. If you come into encounter detail, this kind of works in line with a family practice visit, top to bottom, because it lets you select, okay, Susan, what's going on? I have a sore throat. Okay, so it lets you HPI that chief complaint. It lets you do a review of systems. It lets you do an exam. Okay, and this is actually, too, where you would come to do your initial OB exam. You would, you know, chart everything in here. Do an assessment. So you can see I gave my poor little patient pharyngitis yesterday. All right, and then we could order labs. So what we did was we ordered a swab. All right, so we actually said, okay, the nurse was going to do it. So right from the nurse doc or right from office procedures, we could fire right into there, and we could actually order the rapid strep, which is, where is it? Oh, a throat culture, right here. This is what we did. So we ordered a throat culture. So now the doctor's in the room with me. He's looked at my throat and thinks, ooh, not good. So he can come in here to office procedures and order a throat culture or a group B strep, whatever he wants to do. When they place that order, okay, not only has it been placed and it's a part of the chart as an ordered, you can see down here. If then he calls his nurse and says, oh, can you go, let's swab her throat. She can come in with a swab kit. She swabs. She leaves. She can actually come right back over to her nurse doc here after it's done to result it, because the order is going to be living in here. There's my throat culture right there. So again, a double click opens up orders management, and we can say it's been performed, it's been received and completed, and the result is it is positive for strep. Submit the super bill, save and close. All right, so now the doctor, and of course, the doctor's, nurse is going to go back in and say, okay, it's positive, or doctor could come into orders management, and look at it. But again, you're not going to stop talking to each other. You can still utilize the templates to order and result and bill, but you're still, here it is right here. You're still going to go tell the doctor it's positive, and then at that point, okay, I'll come back over now to my encounter details. The doctor can then make his assessment and then do his, plan of care for patient, whether it be ordering an antibiotic or whatever the case is going to be.
Is there
So,
a
outside-
place that you bill, that you select? Because if you need to make, like for us, we would bill this, with a modified 25 and another,
Yeah, and what Liba and I did yesterday was, after it's all charted, so again, the review of systems, everyone works the same way. There's my vital signs grid, and then here's my physical exam. Just the difference on this encounter detail is you don't have that one button to go to a master exam. You would, a normal is checking the checkbox. Clicking into the link actually charts the findings. Okay, but then again, if this is something you would bill for, so we're billing for the strep, and then we're going to bill a straightforward visit for, actually evaluating and doing the decision making. When you come to the E&M coding template, because this visit is indicated as an OB prenatal visit initial, and I already coded this yesterday, you have to manually code it. If you try and calculate the code, it's not going to allow you to do it, because you're doing the whole global charge at the end for the pregnancy. So you would actually have to hand select a code and then put the modifier on it if need be, and then submit the code.
Does it show you insurance here, anywhere here? Because we have, in New York, we have, some plans that don't do global.
Oh, okay, so you could bill monthly?
We build, per visit.
Okay, yeah, this patient just doesn't have any insurance attached to it. It would display right here in this field.
Right.
Yeah, so you can look right at that and say, oh, okay, this is the insurance we're going to bill monthly, or no, this is the global insurance.
Okay, good.
Yeah. So, yeah, our little test patients usually don't have everything we need. It got quiet. Did Dr. Dorfman leave me again?
Yeah, he had to go to the other office.
That's okay. All right, so let me come back over here. So that's basically the whole rundown through those tabs, ladies. And I actually, when you first look at the OB suite, you kind of take a step back and go, oh my goodness, what have I got myself into? But if I find, just since I've been using them now, and I think you'll find over time too, they're really nice templates, and the final outcome of the documentation is wonderful, and they're really quite simple to use. Just completely different than the intake OB, right?
Yeah, it just takes a little longer at the initial.
Yeah, your only deficit's going to be in the beginning is your lack of knowing exactly where to go. But just like you learned how to do email, and you learned how to use Microsoft Word and Excel, and maybe if you use any other products, it's just repetition, and then it's going to cement in your mind, right? You're going to be like clicker happy, when you get to know these templates, because you're going to know right where to go. So, I've gone back to sites. I went back to, was on site last week after I survived the tornado in Oklahoma.
This is a child.
And a month after go live, and I was almost in tears watching my doctors who I had brought up through the whole system, trained them, was there for their go live, watching them chart runtime, and it was amazing. It's really, to get from the point where they're all deer in the headlights going, we can't do this, it's never going to work, to a month later, them not only seeing their full patient load, but seeing more patients because they have more time.
Very good.
So trust me, you will get there. It's gonna be painful, but you'll get there. Can we take a 10-minute break so I can run to the powder room, and then we'll go over the postpartum and the pregnancy outcomes templates?
Yes,
Okay, fabulous. We'll come back at 10:45.
okay,
Thanks, ladies.
all right. So should we leave this on?
Yeah, huh?
Dr. Kulwa is in meeting over there.
Dr. Who?
Kulwa. She's over Kulwa. She's over there?
Hold a second.
Kulwa.
I'm just,
Is she over there in the meeting? Or she have a...
she should be well.
No, I have 2 messages from her.
Where's she working today?
On call. Dr. Kulwa.
If you see Dr. Kulwa in the
Is she in the
conference
meeting?
room?
She's not there now. She have walked out. Good afternoon. Good morning. Thank you for calling Grand Comprehensive Medical Group.
About anything for calling your friend comprehensive health medical group, calling speaking, I'm Monica. Fine, thank you. Yes, we do. Yes. You're welcome, sir. Hello? Yeah, how you patient?
That's not the right sound. Good morning.
Hold on a
Thank you
second.
for calling Grand Comprehensive Medical Group. My
Thank
name
you
is
for calling in, for calling speaking. Can you hold a second?
Pardon me? She,
Thank you for
no,
calling
she
in,
won't
for
be in
calling
until
speaking.
12
How may I help
o'clock
you?
then. Alright, I'll just take the
Hello?
message.
Your daughter ever come here before?
What's
What
her
is the
name
child
again?
coming in for?
S.H. Miller. Telephone number.
Can she come on Monday? 1:45.
That's 347-232-7804. Shanique Miller.
What insurance she has?
Okay.
Health Plus?